Sex is an integral part of the human experience for most adults. As a basic physiological need and expression of intimacy, sex provides a myriad of physical, emotional, and social benefits when engaged in safely and consensually. However, sexual activity does carry risks as well, especially for those with underlying medical conditions. For patients recovering from a heart attack, resuming sex can be intimidating. But with some precautions, most can enjoy healthy, satisfying sex lives after cardiac recovery. An active sex life is correlated with numerous health benefits. These include lower blood pressure, improved cholesterol and blood sugar levels, increased immune function, and elevated oxytocin, which reduces stress. Orgasm also promotes relaxation and contentment. One study found people who have sex at least 2 to 3 times a week appear 7 to 8 years younger than their actual age. Sex triggers cardiovascular exercise, which strengthens the heart over time. It also boosts circulation and blood flow, delivering oxygen and nutrients throughout the body. Research correlates frequency of sex with lower rates of cardiovascular events and mortality. For men, frequent ejaculation limits carcinogen accumulation and may prevent prostate cancer. High estrogen exposure from sex appears protective for premenopausal women against breast cancer. Having multiple pregnancy cycles correlated to lower ovarian cancer rates. Frequent sex may also reduce endometrial cancer risk. Sexual stimulation releases endorphins acting as natural painkillers. Orgasm specifically can alleviate migraines, menstrual cramps, arthritis pain, and more. Pain thresholds have been shown to double after orgasm. Sex promotes intense emotional intimacy and feelings of desirability between partners. The oxytocin released during affectionate touching and orgasm creates a sense of closeness, trust, bonding, and contentment. This empowers healthy communication between couples. Animal research indicates sex stimulates neurogenesis in the hippocampus, boosting memory, learning, and cognition. Components in seminal fluid may support brain growth and functioning as well. For women, regular vaginal penetration and pelvic floor contractions during sex strengthen muscles controlling urine flow. This conditioning can prevent urinary incontinence issues through natural Kegel-like effects. Body image frequently improves with sexual experience, exposure, and affirmative feedback from an appreciative partner. Increased libido and vitality from good sex reinforces self-assurance as well. Successfully pleasing a partner also builds confidence. The relaxation innate to climax helps initiate deeper sleep cycles. Sex also suppresses cortisol, allowing restorative sleep. Sleep quality means better concentration, productivity, vitality, and health. While sexual activity is healthy for most adults without contraindications, it does carry some risks, requiring precautionary considerations. Elevated physical exertion from sex can precipitate issues in those with heart disease, like angina, arrhythmias, hypertension issues, or heart failure. Warning signs to stop include chest pain, dizziness, palpitations, acute shortness of breath, or loss of consciousness. Reduced blood flow to the brain during vigorous activity may exacerbate neurological conditions like dementia or prior strokes. This manifests as sudden onset, impaired speech, confusion, weakness, or blurred vision, which requires prompt evaluation. Overextension of muscles, fractures, contusions, sprains, and strains can occur during sex, especially with acrobatic positioning. Vigorous thrusting may also result in penile fracture if penetration is suddenly obstructed. Those with depleted immunity from chemotherapy, antivirals, chronic diseases, or medications that suppress the immune system are at higher risk of infections from sexually transmitted diseases. Barrier protection is vital. Between contamination and urethral inflammation, women are disproportionately susceptible to painful UTIs requiring antibiotic treatment post-coitus. Peeing shortly after sex may help flush bacteria from the urethra. Friction disrupts the vagina's pH balance, enabling fungal overgrowth of candida. Symptoms include vulvar itching, swelling, soreness, rash, pain, and cottage cheese discharge. Topical antifungals or oral fluconazole typically resolves yeast infections. Unless contraception is utilized or individuals are infertile, vaginal sex with ejaculation into the vaginal canal remains an impregnation risk. Attention towards birth control is vital to prevent unwanted pregnancy. Until medical clearance by an OB/GYN, individuals recovering from childbirth could exacerbate healing tears, rupture sutures, risk postpartum hemorrhage, or introduce bacteria with vaginal penetration too soon after delivery. Myocardial infarction patients often worry about returning to sexual activity too soon, or if performance might be compromised from a psychological and cardiovascular standpoint. Reassuringly, research indicates most patients can safely resume satisfying sex lives within a few weeks of an uncomplicated heart attack, with some temporary adjustments. Cardiac rehab programs generally recommend 4 to 6 weeks of sexual abstinence after heart attack before slowly easing back into intimacy. However, delays up to 3 months may be advised for complicated patients undergoing bypass surgery, valve repair, revascularization, or exhibiting heart failure. The cardiac rehab team will tailor recommendations to each patient's unique risk profile based on areas of myocardial damage, ejection fraction, comorbidities, and procedure specifics. If concerning symptoms manifest upon initial attempts at sexual activity post-heart attack, the patient should cease exertion immediately. While these may just indicate the cardiovascular strain from sex is too much too soon, acute symptoms always warrant evaluation to rule out new cardiac damage or other potentially lethal mimics like a pulmonary embolism. When in doubt, stop sexual activity and consult a doctor promptly. Until the cardiac rehabilitation team formally clears a post-heart attack patient for normal sexual functioning without restrictions, several precautions may be advised. Avoid being on bottom. The exertion from actively thrusting initially may be excessive cardiovascular strain. Let the partner do the work first few times. Don't have sex after heavy meals, which divert blood flow to digestion. Keep the room slightly cool to prevent overheating. Have any cardiac medications nearby in case nitroglycerin is required for angina. Hydrate well before sex to prevent blood pressure drops. Monitor HR. Use devices like smartwatches to ensure heart rate doesn't exceed targets. Avoid unrealistic expectations. Erections may be attenuated until cardiovascular function improves. The typical missionary position, man atop woman, exerts the most cardiovascular demand. Alternative positions putting less strain on the heart include side-by-side scissoring position, woman or receiving partner on top provides more control of depth intensity. Standing from behind minimizes workload. Spooning enables rest periods as needed. Oral sex, mutual masturbation, sensually touching, massage, and other forms of outercourse allow for intimate connections with minimal cardiovascular strain as well. Beyond physical precautions, the emotional impact of resumed sex after heart attack should be addressed too. Stress, anxiety relating to sexual performance or precipitating another cardiac event are common. Depression and struggles with self-image frequently manifest after any major health trauma. Partners often experience apprehension about causing harm. Psychotherapy facilitates working through these intimacy barriers. Pharmaceutical options for enabling safer post-heart attack sex include nitroglycerin, relieves angina precipitated during sex. Sildenafil, improves erections without straining the heart. Beta blockers, control exertion-related tachycardia. Of course, all medications carry risks, warranting doctor discussions for the sake of informed consent. But used judiciously, medications can complement cardiac rehab in resuming healthy sex functioning. When practiced with proper education on risks and adjustments specific to each patient's health status, most can enjoy partner intimacy through outercourse or for full sex comfortably within the first 2 months, even after major cardiovascular events like heart attacks. Open dialogue with rehabilitation specialists addressing worries related to sex facilitates safely easing back into things physically and emotionally. While avoiding exhaustion, cardiovascular patients gaining confidence in their sexual capacities again helps return a sense of empowerment and normalcy.